Hi, my name is Melissa Stockwell. I'm from the Department of Pediatrics and the Department of Population and Family Health at Columbia University, and I'm here to provide information on pediatric long COVID under the Long COVID Education and Engagement and Care Management Project from the Council of Medical Specialties Societies funded by the CDC. I'm joined here today by Dr. Rachel Gross from the Departments of Pediatrics and Population Health at NYU Grossman School of Medicine. So most of what we know about long COVID is from adults. And when it comes to long COVID in children, there really are more questions than answers. And there are a number of common misperceptions. First, that children do not get long COVID, but we know that they do. And if they do get long COVID, their symptoms must be the same as those in adults. And we're going to share with you in the ways that they really are not. There's also a common misperception that if they get long COVID, they're going to get better quickly. This all leads to an under-recognition of long COVID in children and adolescents. We know long COVID is a pediatric public health problem. Based on the number of children who've been infected with COVID, as well as the incidence of long COVID, up to 6 million children in the US could have or currently have long COVID. Yet most children with long COVID do not receive a diagnosis, treatment, or coordinated care. So what is long COVID? In 2024, the National Academies of Sciences, Engineering, and Medicine put forth a long COVID definition. Long COVID is an infection-associated chronic condition that occurs after SARS-CoV-2 infection and is present for at least 3 months. It's continuous, relapsing and remitting, or progressive disease that affects one or more organ systems. And there are a couple of key important components. First of all, many people may not know if they've been infected with SARS-CoV-2 or not, and so we do not need laboratory confirmation or other proof of initial infection. Second, while the duration must be at least 3 months, it could be symptoms that are continued from the original infection, or they often can have delayed onset after the acute infection. There are more than 200 symptoms and conditions that have been associated with long COVID, and we're going to outline some of them that have been associated with pediatric long COVID. And it's also important to know that an infection could be of any severity, including asymptomatic infection. Symptoms can be mild, severe, and may resolve over a period of months or sometimes over years. And long COVID can affect children and adults regardless of health, disability, SES, age, sex, or other demographics. And most importantly, long COVID can have a severe functional impairment, and that includes in children and adolescents and can impact the way that they're able to go to school and spend time with their friends.
Hi, everyone. I'm Dr. Rachel Gross, and thank you for having us today. So, how does long COVID present specifically in children and adolescents? Similar to adults, long COVID in children is a heterogeneous collection of symptoms, with different symptoms presenting in different children. And symptoms can occur in almost every organ system of the body. Yet large studies have found that in children, the prolonged symptoms of long COVID are similar yet distinguishable by age or developmental stage. Common prolonged symptoms in both school-age children and adolescents include general symptoms such as trouble sleeping, being tired after walking, referred to as post-exertional malaise, poor appetite, and daytime tiredness, sleepiness, or having very low energy. They also include feelings of depression, anxiety, and fears, as well as neurocognitive symptoms like headache and trouble with memory or focusing. They can also experience feelings of lightheadedness or dizziness, having stomach pain, nausea, or vomiting, as well as generalized body, muscle, or joint pain. Some symptoms are also more common only in school-age children, such as specific fears, school refusal, palpitations, and rash. And other symptoms are more common only in adolescents, such as panic attacks or change in loss in smell and taste. In addition to understanding the individual symptoms that children and adolescents can experience, symptom clusters or different types of long COVID have been described. Two of these clusters are found in both school-age children and adolescents. One with many symptoms across multiple organ systems, and a second predominated by pain and fatigue and low energy. Two unique clusters have been found in only school-age children. One characterized predominantly by trouble sleeping and trouble with memory and focusing, and one characterized predominantly by stomach pain and nausea and vomiting. And finally, adolescents have a unique cluster with change or loss in smell and taste being their primary prolonged symptom. But what about long COVID in early childhood? In general, the most common symptoms in early childhood are those which are observable by the parent or caregiver. The most common prolonged symptoms in infants and toddlers include trouble sleeping, fussiness, poor appetite, stuffy nose, and cough. And the most common prolonged symptoms in preschool age children include cough and daytime tiredness, sleepiness, and low energy.
So, what can a pediatric clinician do for the evaluation and treatment of long COVID? There is currently no laboratory test that can be used to diagnose long COVID in children or adolescents. So, the American Academy of Pediatrics currently recommends a stepwise approach for evaluation and management. First is to focus on determining level of symptom interference with daily functioning and make sure we enforce and aid healthy lifestyle habits like sleep, diet, light activity as tolerated without symptom exacerbation, and make sure we're ruling out other causes of ongoing symptoms. Some initial tests to consider to rule out conditions that could look like long COVID. Those might include a CBC, a differential, a comprehensive metabolic panel, C reactive protein, an ESR, ferritin, thyroid function tests, vitamin D level, and EBV antibody panel. Symptoms persist beyond 3 months and or impact the patient's ability to perform normal activities, they may be warranted to refer to a multidisciplinary pediatric long COVID clinic if readily available, or if not available, to consider referral to a pediatric medical subspecialist based on the individual signs and symptoms for evaluation and management. There's also a summary of the symptoms that we have reviewed that's available through the JAMA Pediatrics, the patient page. That could be helpful both for clinicians, but also for parents to bring to their pediatric clinician if they are concerned about long COVID. There are also additional resources that are available at cmss.org.